The 2014 Oppenheimer Fellowship has been awarded to renowned academic and lung TB expert Professor Ketan Deda of UCT. The prestigious Oppenheimer Trust Award is granted to top scholars engaged in cutting-edge, internationally significant work that advances knowledge, teaching, research and development in South Africa. All of the above defines this year's recipient, who happens to be our guest from our Cape Town studios, Professor Ketan Deda, the head of the pulmonology, and I can't get it out of my mouth, Professor, from UCT and Groote Schuur Hospital. Good morning to you and welcome.
Thank you, and thanks for having me on the show.
Professor, congratulations first and foremostly. When you received this award, how do you feel about it?
No, I think it's a wonderful affirmation of our work. As you know, I work in the field of tuberculosis, and tuberculosis is not a glamour topic and doesn't make headlines like the political and the high-profile sports stories. So it's nice to recognize a disease of poverty, and after all, it is the commonest killer in the nation, and it is a major public health problem. So we're delighted with the award, of course, and we're very happy that it showcases the problem of TB in South Africa.
Just remind us again what the research that earned you this prestigious award actually highlighted. Is it only TB?
Well, the Oppenheimer Foundation and Memorial Trusts annually bestows the Oppenheimer Award on a person of exceptional scientific quality and distinction, and it can be made in any particular branch of science. It could be physics, it could be chemistry, it could be medicine. And this year, the award was made recognizing our work in the field of drug-resistant TB. There's also a monetary award of 1.5 million rand, which is to undertake a specific research project. And we will be looking at cases of highly drug-resistant TB, XDR TB, and incurable cases of TB that has now become a problem in South Africa.
Now, you are from the pulmonology department there, but you're also involved in more research regarding incurable illnesses. Tell us more about that.
Well, for example, earlier this year, we published a paper in a medical journal called The Lancet. And what we showed in that paper is that the conventional strain of TB has now been replaced by very highly drug-resistant strains of TB called XDR TB. And we've progressed beyond that to what we call TDR TB, or totally drug-resistant TB. These are completely incurable strains of TB. And there are several aspects that we are working on. We're firstly looking at the transmission of incurable TB in the community. We now have a situation where this disease, we don't really have drugs to treat this disease, and patients are in fact being discharged back into the community out of therapeutic frustration. So they're therapeutically destitute, and we simply don't have the drugs to treat this form of TB now. So we're working on several aspects. One is transmission dynamics. The second is to look at how we can more efficiently diagnose this condition. And thirdly, we're also looking at how we can better treat this condition. For example, we have a award or a grant from the South African Medical Research Council as part of the flagship award scheme for about 18 million rand. And we're going to be trialing a new regimen for drug-resistant TB using new drugs. And we're going to look at this combination of therapy and see whether we can address or help to address this problem of incurable TB and try and improve the situation in South Africa.
Doctor, do you believe, though, that TB is out of control in this country and as such poses a threat to our economy?
Well, I think it's completely out of control. We treat almost 500,000 cases a year. It's now the commonest cause of death in our country. It mainly afflicts economically active young individuals, and drug-resistant TB, in fact, is a major killer and has a high mortality. And if you look at the number of deaths due to HIV-associated TB and drug-resistant TB, it accounts for almost half the total TB deaths globally. So I think it is a major problem, and I think we need to do a lot more in trying to tackle TB. There are many steps that are being taken. I think the more we hold hands together and join forces to fight TB, then the more we can do to help to control the disease. I think also, though, it's worth mentioning that TB is also a social disease, and the main drivers are, in fact, poverty and overcrowding, and of course HIV. So whilst we as researchers are trying to find new vaccines and better diagnostics and better drug regimens, if we don't address the issue of poverty and overcrowding and don't address the socio-economic issues in tandem, then I don't think we'll be able to control this disease.
And so what you're saying is if we don't eliminate those, then the eradication of TB we will not see in our lifetime.
Well, I think we need to address the issue of poverty and the way money flows around the world and the socioeconomic conditions. We need to address the issue of political stability. And unless we address all those issues in tandem with better drugs and diagnostics and vaccines and so forth, it's only then I think that we will control the disease, yes.
Now, Prof, you're also one of the prominent organizers of the South African National Tuberculosis Conference taking place in Durban this week. What is the purpose of the conference?
Well, the conference is actually a gathering of researchers, policymakers, healthcare workers, and anybody really interested in TB, including advocacy groups. And it's really a meeting to bring people together to discuss the issue of tuberculosis in South Africa and all aspects of TB, including the interaction with HIV and TB, drug-resistant TB, TB in healthcare workers, so that we can formulate better strategies to eradicate and help to control this disease in South Africa.
Professor, thank you so much for your time, and once again, congratulations on the award.
Thank you. Thank you.